My name is Tiffany Stark for those folks that have not met me. I'm one of the public health program managers here at NCUIH. And also joining me today is my colleague, Myca Hunthrop, who is one of the public health project coordinators. Myca and I will be your co-hosts, and we thank everyone for volunteering your time today to participate in the discussion. We at NCUIH appreciate your willingness to share your experiences with vaccines for COVID-19 and beyond. And we do understand that this could be a sensitive topic, specifically coming from the pandemic. So we want to reassure you that this is a safe place to feel free to share as much or as little as you feel comfortable sharing. There's no right or wrong answers. We know everyone's in a different place with capacity and vaccine progress. So this is a chance for all of us to learn from each other. So again, we're very pleased that you could join us. Your answers today are very important and will allow us to further understand your needs around adult vaccinations, specifically around COVID-19, the flu, and RSV. We also have, we can help assist with any road blocks as well for those areas. If you do have any IT difficulty during today's call, please chat directly to comms and events, and River can further assist you. And finally, if you could, please enter in your name, UIO, or organization, and any tribal affiliations in the chat box. That way we get to know each other and also count your attendance. And before we begin, just a review of some few housekeeping items. So please, if you do have video capability, enable your camera. We do like a more interactive environment. And also note that your microphones are muted currently, but you will have an opportunity to ask questions at the open discussion portion. And you can also raise your hand on the bottom if you'd like to be called on, or just unmute if there's silence and pop in. And our chat box will be monitored as well, so please feel free to drop any questions or comments along the way, and we will address those at the designated time. And we also just want to note that this session is recorded for educational and quality improvement purposes. And we do have our acknowledgement for our project. So this content was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention for 2107. The Centers for Disease Control and Prevention is an agency within the Department of Health and Human Services, or HHS. The contents of this resource do not necessarily represent the policy of CDC or HHS, and should not be considered an endorsement by the federal government. And to begin, for any new folks that are joining us, the National Council of Urban Indian Health, or NCUIH as we like to say for short, is the national nonprofit organization devoted to the support, development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. And then we do have our reminder for our evaluation. We have both the link and the QR code. This will definitely help us to better support you with your needs, especially around vaccines. And taking a look at our agenda for today, so we have two presentations. The first will be by Ruby from Bakersfield American Indian Health Project. And then we also have Nicole from CDC Influenza Division. And then we will have the open floor for questions and comments and the conclusion. So at this time, I'd like to introduce Ruby. So Ruby is the Human Resources Coordinator at Bakersfield American Indian Health Project. Ruby hails from California, but was raised in Bakersfield, and she's been working in the medical field for over 14 years. So at this time, I would like to pass the presentation to Ruby, and please feel free to enter in your favorite emoji into the chat to welcome Ruby.
Thank you, Tiffany. Can everyone hear me okay? Thumbs up, you can hear me?
Yes.
Thank you. Thank you. Okay. Next slide, please. We can skip this one as well, just another intro. So we wanted to discuss the best practices to help support the vaccine toolkit and educational material that we utilize here at BAIHP. And when I was speaking with Tiffani earlier, she reminded me of the Good Relative initiative that we launched earlier or in a previous campaign. That is something that we still highly use in-house, not only for the full clinic, but also in our infection and prevention control program for our staff. So even in the behavioral health side of the clinic, we find it's important to educate them and have that training available through our online portal or our Relias platform. Next slide, please. Continuing the education goes into having the standard operating procedures for the medical staff and the behavioral health and the clinic as a whole. That includes monitoring the temperature for the refrigerators to maintain the efficacy or potency of vaccines. And policy-wide or building-wide is educating staff, like I mentioned, through our infection and prevention control. Also some basic understanding of standard precautions and vaccine information of why it's important and when we should get it as well. And educating on compliance and why it's important. Coming from an organization where we primarily focus from referral and outreach, trying to move into an area where it's AAAHC or Joint Commission accredited, and having a full-time on-site provider, a lot of the staff didn't understand that transition or why it was important to have these compliances and policies in place. So that has been a something that's new for a lot of staff, and we're implementing those policies, those SOPs that maybe had not previously existed. And we're building those as a team, not just through HR, but working with our medical provider, working with NCUIH. Thank you for your technical assistance on a lot of these things, because it's all new for all of us. And even sharing with some of our other UIOs, asking them what has worked for you, what were some of the barriers. Also reporting the administration of these vaccines and knowing the importance of when to reporting it quickly to the public health department, and moving from registration that's could be like a quick access as opposed to having the full onboarding for a client and sending that information over in a timely manner. Again, some of the other hygiene or other training we include is hand hygiene, the PPE for administering, disposal of sharps, and waste as well. Next slide, please. We highly rely on NCUIH to help us kind of gauge where we stand in compliancy and some of the policies. But we also partner with our local public health department. What we have, or what we currently have in-house, is a part-time medical provider who doesn't specialize in pediatrics. So that causes a bit of a barrier for parents or young adults or youth who need to get these vaccines. So we partner closely with the public health department to share that information with parents or guardians for the younger age, especially because we don't specialize in peds, and either refer them to their primary, and if they don't have one, we refer them to public health department, provide them those materials, whether they're having a vaccine clinic or a mobile clinic. And that's another really good resource for us locally. Next slide, please. We're going to go into best practices to increase community visibility of vaccines and the importance of getting vaccinated. I think it's not a new subject for everyone online. This is an ongoing battle. What we like to do is outreach at our events, so community events with our community partners here or other UIOs or remote locations or smaller communities that are not as close to our location here. So we'll also go out and partner with them at their activities and share information. Next slide, please. this is an example. This year we had our spring gathering in March, and we sent out our invite to the local tribal organizations or remote locations and invited them to come and get information, not just about vaccines and all the other resources we have, but in nutrition as well, and promote the overall health and wellness. We also had a backpack drive. This year, our backpack drive ended up being a drive-through, but what we really focused on was having a sign-up sheet. If someone had a question about physicals or vaccines for their kids. And because we didn't have a booth, what we did was gather information from participants and then reach back out to them at a later point so we can help them figure that out or navigate what the best practice was for them. Agona this year, we had a flu vaccine sign up, and influenza. When I did speak to our medical provider and our medical assistant in-house, right now what we only carry is influenza. So at this time, the influenza vaccine, at this time, we don't have the new COVID-19 booster. And I'm not sure if it's just because they haven't provided it yet and it's not mandated. So that's one of the other focuses. Like, we don't carry because it's not mandated to have that booster. It's a recommendation by CDC. So once we can get it more information, education, then we'll likely have it on hand as well. And let's see. Native Heritage Month is coming up as well. We will be having a booth there or a vaccine venue there. It will be focused on influenza and health promotion and provide those resources. We also partnered with the Chambaralabo tribe, which was remote, and they had their winter fair, health fair. The idea was that there are hundreds of these folks of this tribe or in this remote location that hadn't received vaccines, not just COVID-19, but any traditional or maintenance vaccines. And the turnout, even though we pushed this information out, turnout was pretty low for receiving vaccines. And it's because there were some barriers. It was the education or the belief that the vaccines was another way for government to control. So that led us to see what some of those barriers were. Even though we expected a huge turnout, it didn't go the way we expected. Next slide, please. So the important part then is to really share the information of the importance of getting vaccinated. And we do that through materials from CDC and our partners here with the Public Health Department to provide those calendars on the dates of when vaccinations or immunizations should be administered, and the importance of really tracking the vaccinations depending on whether you're moving from one provider to another. It's important to make sure that we receive, or the client receives, those vaccination records. We also will use our patient chart for patient reminders, especially during the influenza season right now. Those who have come through the clinic will send out reminders. Hey, we have influenza vaccine available. Schedule your appointment if you need to. Or we've had clients say, well, I've already received it from my primary care physician. We just ask that they share that with us so we could update our system as well. A lot of our, or not a lot, but several of our clients will come in because they aren't able to see their primary care physician. So we just need to make sure that we're sharing that information from their primary care provider to the clinic here. What has been the best turnout is, of course, providing a financial incentive, especially through COVID with our partners at Public Health and CAPK, which is a local organization. They were able to provide us gift cards. So even up last year, we had $100 gift cards to incentivize for clients or participants to receive their COVID-19 vaccine. And that was actually a pretty good turnout. And making the vaccine accessible, again, going out to the outlying areas was an important part as well. Some people don't have a method of transportation, especially one of their communities is an hour and a half out. You have to go through a really scary canyon. The drive is pretty scary. So we went out to them and met them where they were at. And that's important as well. You got to meet people where they're at and where they're comfortable. Next slide, please. And then we're going to shift it to learn how to make the best use of the vaccine materials. Next slide, please. Again, we go back to building a community partner network. So creating rapport with our community partners and or the tribal council, the tribal chief, or other UIOs, so that they feel comfortable, that we share that information with them. We start with them asking if they're comfortable with us coming to their organization and collaborating, and really honing in on the importance of vaccines and wellness. So once we can share the information with them and they get that buy-in and understand that it's about wellness and that we're here to partner with them and assist wherever we can, that provides their backing and they can share that information. It trickles down into the rest of the organization where we become also a partner for them that they can trust. So a trusted source is huge in Indian country. Again, also follow-up when we have our events is another key component. So it's great, yes, to have an event and spread those resources, but if you don't follow up, you're really falling out and your numbers, you can't get those numbers in. So that's a huge, like, do you have a plan? There have been a couple of outreach events that we had, and before we grew, it was difficult to keep up with that list of follow-ups. Now that we're growing, it's a little bit smoother. We've kind of worked out some of those kinks. And so now it's running a lot more smoother. We have follow-up, we can get people in, we can have a vaccine clinic. So that way we're not wasting or misusing some of our resources as well. And lastly, we have a community meeting, which is a quality, a QA/QI, quality improvement, just not for in-house, but with our partners. Do they feel like we are working and collaborating together to reach the most amount of people to include with our vaccines or any of our resources? Next slide, please. Oh, that was it. Thank you.
Thank you, Ruby. At this point, we would like to introduce our next speaker. So we have Nicole from the CDC Influenza Division. Nicole currently serves as the campaign and digital outreach lead in CDC's Influenza Division. In this position, she oversees the seasonal flu vaccine campaign, social media activities, and partner cultivations, and outreach. So at this point, I would like to pass the presentation over to Nicole, and please enter in your second favorite emoji to welcome Nicole.
Thank you so much. Can you hear me?
Yes.
Great. We can go to the next slide then. Again, my name is Nicole Richardson-Smith, and I serve as the Campaign and Digital Outreach Lead in CDC's Influenza Division. I really appreciate you inviting me here to just share some about our seasonal influenza communication campaign efforts. Next slide, please. So I just wanted to help set the stage as we were trying to figure out this year's communication campaign. There were just a number of factors at play. We were looking at some significant drops in flu vaccine coverage among children and pregnant people over the last few years. We know that there's ongoing racial and ethnic disparities, as well as we're seeing a growing disparity between rural and urban uptake of flu vaccine. As you know, this summer, there was the recent ACIP recommendations for an updated COVID-19 vaccine. And this season, we've also seen the introduction of RSV immunizations. And then just overall, there's just been a broad-based effort to really catch up on all immunizations across the board from drops that we saw during the COVID-19 pandemic. So all of this was what we had in mind as we started thinking about our communication campaign approach. Next slide, please. So our outreach is multi-pronged. So we use earned and paid media. We also have organic social, and we have some social and digital and partner activations, all to get the message out about the importance of flu vaccine. So we have one major campaign with the Ad Council and the American Medical Association. And this campaign specifically looks at addressing drops in vaccine uptake among Black and Hispanic adults. And then we have another campaign that we're going to talk about, which is in partnership with Weber Shandwick. And this year we chose to put a specific emphasis on parents that have children 6 months to 17 years old and pregnant people. We also have routine outreach that we do with other high-risk groups for flu, and that can include the adults 65 and older, those with chronic health conditions, as well as we message specifically to healthcare professionals. Next slide, please. So I'll first talk about this collaboration we have with Weber Shandwick and this year's seasonal campaign, Wild to Mild, which you may have seen already out, and how it came to be. So over the summer, we tested several concepts. You're seeing 3 on the slide here. There's actually a 4th, but in testing, it just wasn't doing well. So we pulled it out and continued testing with these 3. We had focus group sessions with parents of those that had children 6 months to 17 years old, as well as we had focus group sessions with pregnant people. Next slide, please. I just want to spend some time talking about what we learned in those focus group sessions. So when we were talking to the parents, they were continually thinking about the health and well-being of their kids. Those parents that had younger children, they were really concerned about development, healthy nutrition. Parents of older children were more focused on mental health related issues. Respiratory diseases were not brought up initially in these discussions on the focus group session. So it really didn't seem to be top of mind for many of the parents. When we did probe about flu, about half the parents in the focus groups mentioned they would get their kid vaccinated. And the other half said that they were not planning to get vaccinated. For those parents that did want to get vaccinated, they said it really was just to keep their kids healthy. And then the ones that weren't going to get vaccinated, they said they felt natural immunity was more important, or that it was better to be exposed. And I will say this is a theme we have seen through the years for when we're talking to people who do not want to get the flu vaccine. When we turn specifically to that wild to mild concept, participants really liked it. They said it was delivering a new message that they had not heard as much, which is that a flu vaccine can lessen symptoms and severities. They said it really challenged the belief that a flu vaccine is only meant to prevent flu, and it helped reset expectations around a flu vaccine. They said that the information felt truthful and realistic, and they especially liked that this was a message coming from CDC. They also thought that the bright colors were eye-catching and appealing. Some of the cons to the concept were that some people thought some of the animal puns were a little too much. So I will say we toned those down in the final versions. And then there were some participants who were confused why we were using animals when we're talking about flu vaccination for people. So we tried to make that clearer in the final version. Next slide, please. So that was more from the parents, but I also want to highlight some of the findings from our pregnant participants in these focus group sessions. They too were obviously very concerned about the health and well-being for their baby. A few participants, they did bring up like prenatal vaccinations unprompted, but mostly only the Tdap vaccine. They weren't mentioning flu. Most of the pregnant people in these focus group sessions did not have any intention of getting vaccinated. Some of those that were pregnant with their second child said that they had looked into the flu vaccine, their first pregnancy, didn't get vaccinated, and were not planning to get vaccinated this time. And I will say, we have seen a concerning drop among pregnant people, more than 15% over the last 3 years with flu vaccine. And we wanted to know from these focus sessions really what was turning them away. We didn't find just one specific thing. What we did find was a lack of awareness about the benefits of vaccine and a concern about the safety and what they were putting in their body. There was widespread lack of knowledge about the benefit of the vaccine, specifically how the vaccine can protect the baby who's too young to get vaccinated once born. So once we shared this was actually a point that the participants found very motivating. And then just in general, they wanted numbers, data that could help them make their decisions about the vaccine. There was some messaging that used the word death. People didn't like that. They said it seemed to be a scare tactic. And I will say another thing that we're seeing a bit more now, post-pandemic, is just a growing cynicism or suspicion about CDC in many of the groups. Next slide, please. So this, from taking those focus groups over the summer and doing some refining, this is what we came up with. It's wild to mild. We ended up doing a soft launch in mid-August with a few of these assets, and then we officially launched the first week of September. I will say we did not get to test every animal pairing over the summer, but in partnership with our CDC's Communication Science branch, they have a rapid user testing tool. So we were able to test some additional animal pairings. And then we also had some testing to look at translation into Spanish. There was different ways you could say wild to mild, and we wanted to see what resonated best with those audiences. I will say what you notice in these graphics beyond the bright and bold colors really is that juxtaposition of a wild or a ferocious animal with a milder, meeker animal. And again, the idea is that, you may get sick from flu even if you're vaccinated, but you won't get as sick. And again, people in this user testing, they responded that this was newer information that they had not heard before, and they really liked that CDC was being forthcoming and transparent with this messaging. Next slide, please. So this is just an example of an Instagram story that went out on the CDC Instagram main account. Again, we talked about what we heard in the focus group sessions with pregnant people, and we really wanted to mention how the vaccine helps not only the pregnant person, but also the baby who can't be vaccinated right after being born. So that was what we emphasized in this Instagram post. A couple weeks ago, we also had shared another wild to mild video on the main CDC accounts, and this one had the shark and the goldfish. And we have a number of additional animal pairings planned, including some Halloween versions with some puppies and kitties in costumes that we think will be fun for the month of October. Next slide, please. Just want to share some of the coverage and feedback we're getting about this concept. There's been a number of news outlets that have covered the Wild to Mild campaign, including the Today Show, CNN, Forbes, CBS News, and it was really just great to see the campaign mentioned by name and mentioned favorably in these clips. So it's just been great feedback so far. Next slide, please. So I just want to mention, and go on to the next slide, please. So I just want to mention that we have a number of these resources that you can use as well. So we have them on our CDC flu resources page. I believe my colleague Claire will put the link in the chat. So there are graphics you can customize for social media. Also, you see in the middle is one of those social media frames. So you can put your own picture in there and share that you've been vaccinated with your social media audiences. And we just encourage you to use these resources. We're adding some posters, I think this week or early next week, and share them with your audiences. Next slide, please. So I'm going to turn back to the other campaign that I mentioned at the start of this presentation, and that is our work with the Ad Council. So over the summer, we also did some testing with them to look at some assets that have been developed over the last year. They continue to test very favorably, so they have been redeployed this season, beginning in September. There's a number of series within this. It includes No Time for Flu, Flu FOMO, and Doctor's Orders, which is where doctors are answering some of the most common questions that they've heard about flu vaccine. There's also PSAs that run in English and Spanish across all platforms, and this was in space donated by the media. We have a micro influencer outreach as well as macro influencer outreach, and that's a bit new this year. So we're looking to work with influencers to have a bit larger following and just see if we can continue to maintain this positive tone with those engagements as we're sharing messages. And again, with this campaign specifically, we really are prioritizing reaching Black and Hispanic audiences. Next slide, please. I also mentioned we have some content for our informed audiences. So you can see this is a message. There's one in here for healthcare providers and some other general messaging that we also have available and are sharing across all of our platforms. And next slide, please. So before I end, I just want to mention again our broader framework. So for many years, we have used Take 3 as a messaging platform for flu, and that means taking time to get vaccinated, helping prevent the spread of flu viruses with everyday preventive actions like washing your hands, and then taking antiviral drugs if prescribed. We are continuing to use that Take 3 platform, but as we look at this season with other respiratory viruses circulating, we've made it a bit more general. So this is just some of the messaging you'll also see from CDC this fall and winter. Again, almost all of these resources are already on our flu website or are being added in the next couple of weeks and are available for your use. Next slide, please. And again, I just want to thank you for your interest and for sharing our seasonal flu resources. Thank you so much.
Thank you, Nicole. And thank you, Ruby, as well. At this point, we'll open the floor for any questions or comments for either speaker. Yes, Ruby.
First of all, I wanted to say thank you to NCUIH and CDC for making these resources available. We really, really turn to you guys to use those and make them our own as well, kind of tweak them wherever we can, especially during our events. We like to use those resources and print out huge flyers to kind of get people's awareness. And I just wanted to say thank you.
Great. It's nice to know how the resources are used. So appreciate you sharing.
Myca?
Yes, Nicole, I believe in a previous webinar that you've shared that some of these resources are available for organizations to put their own logos on. Is that at that same link that Claire shared, or is there a separate process needed to add those logos?
So those are not on our flu website. I believe Claire can let us know exactly where they're added. You can also just send me a note if there's something specific that you're looking for, and we're happy to share them that way. Because we understand some people want to just use their own logo on them or no logos.
Just double checking the chat. So a follow-up question for the CDC toolkit. So is there any other approval that's needed after adding the organization's logo to the template?
If you would like to share with us how it's being used, that's always great to know. But it's out in the public domain, so you can use it.
Great, thank you. And we'd also like to hear from any other folks on the call about what toolkits or materials have worked best with your organization.
Do you mind if I jump in? I just
Oh
wanted to.
yeah,
One
sorry.
additional, that's okay. I know we've shared with NCUIH on a different campaign, like Project First Line, but the Be a Good Relative was really helpful for us to create the like a gel in, gel out process for our provider side and in our group setting areas. So I used that campaign to add in the gel in, gel out and get people really to think about when they're going into a certain room or group area, oh, the sanitizer's available. Here's an attention getter to get people to disinfect their hands or just use be a good relative and use some of those good practices.
Thanks, Ruby. That's awesome. And that also comes into play. I see there's another question about materials coming out for both flu and COVID vaccine. We do have a Be a Good Relative image coming out shortly that will cover both flu, COVID, and RSV. So more to come on that.
And I can just add from a CDC perspective, I know they're also working on some materials that cover all of respiratory virus season. The Take 3 I mentioned is just one we have, but they're working on a larger campaign. I'm not sure of the timing of that, but definitely there'll be some, resources out there that do talk about all the respiratory viruses this fall and winter.
Thank you, Nicole. And then I do see a question about a flyer of the new recommendations for the newest COVID vaccine. So we do have that information in our newsletter that's providing the new recommendations. And then also CDC, of course, dropped their link as well. And then I do have a question for Nicole. So you mentioned that there was a decline in pregnant people getting vaccinated for flu, and also a decline for children. So is there any other recommendations or materials out there CDC recommends to help with that confidence or that awareness?
Sure. So I know our team this summer, we started doing some specific outreach to those who work with pregnant people. So some provider letters going over this data and just making that strong recommendation for a vaccination. We've also been working with some partner organizations that work with pregnant people, and then also looking at, just even the apps that are out there that are for pregnant people and getting our messages out that way. And then again, with this Wild to Mild campaign, we have this specific focus for pregnant people and children. So again, just trying to tailor our messages for these audiences, knowing that there has been drops in coverage.
Awesome, thank you.
I just wanted to hop on and say that if there are any UIOs out there who would like assistance in reviewing any resources or assistance in acquiring any resources, feel free to reach out to NCUIH through our technical assistance form, and we are more than happy to provide that, and I will drop that link in the chat.
Thanks, Myca. I'm just double checking the chat again. And then I do have another question for you, Nicole. Sorry. It made me think of it with the Wild to Mild campaign. So do you know if there's any upcoming materials that will have more presence from American Indian Alaska Native included in those?
Yes, so we definitely are hearing from various audiences that they would love to see some of these materials translated as well as specific to their audiences. I definitely think we're taking all this feedback back and would love to do some of that. I also know that there's been a recent our center's done a recent photo shoot, and we made sure that there was a IAN representation with those photos. So hopefully those will come back soon, and that's something we can start incorporating.
Great, thank you. And then Ruby, I know you mentioned incentives have been successful, especially gift cards. Were there any other incentives that worked well or that didn't work well that you were able to learn from?
No, our biggest incentive was always a gift card. There was different gift cards that people would prefer. We went with a Walmart or a Gas or Target. Target's a little bit, for some people, they say, well, it's a little bit more expensive. I'd rather have a different kind of gift card, but we only used the gift cards. Yeah.
Awesome, thank you. And the last question that I took down for Nicole, where should folks go to sign up to be an influencer if there's, you know, a large influencer that, you know, people want to recommend?
Sure. So we do have some groups helping us find those influencers. But if there's someone you would like us to consider, you can just reach out directly to me, and then we can share it, because we would love to hear who you're thinking of. If it's not something we can do this season, you know, we're already starting to plan ahead for next year. So please share it with me.
Thank you. Awesome. Checking the chat before we advance. And also too, if there's anything that folks think of as we're wrapping up, please put it in the chat or come off mute. So we can go to the next slide. So we do have our contact information listed, and also that evaluation link and QR code. We would definitely appreciate your feedback on this session, and if there's anything else that we can help support you in for vaccines. Next slide. We also have upcoming NCUIH events. Continuing on with our Paths to Vaccine Equity series, our next session will be on November 9th, and that will be focusing on annual vaccinations. And then also coming back fresh from the holiday season on January 11th, we have our next session, or our final session, excuse me, on mobile clinics. On the 17th of this month, we have our electronic case reporting, or ECR, implementation, focusing on results, successes, and challenges. We also have on the 26th, integrated healthcare through Indigenous approach. And then November 1st, culturally inclusive healthcare, honoring traditions for a healthier tomorrow. And the link for the NCUIH events is also in the chat box too. Thank you, Myca. Next slide. So thanks again to our speakers, both Ruby and Nicole. We truly appreciate you sharing your best practices and the important information for flu. And thank you everyone who joined us today. We'll hang around for a little bit to see if there's any other questions or comments, or if there's anything else that we can help assist with. But thank you everybody for your time, and I hope you have a good rest of your day.